A fear of women is called gynophobia. Historians say the term arose to define the fear of men's experience of being humiliated by women, namely by emasculation. Emasculation means to deprive a man of his masculinity or male identity. In other words, to make him feel weak or not manly enough. Misogyny or the hatred of women is another phrase resulting from the male fear of being humiliated by a female. The opposite of misogyny is misandry, which means a hatred of men. Gynophobia can affect both men and women. Gynophobia symptoms may include an immediate overwhelming fear or worry or terror when you see or think about women. An understanding that your fear of women is unwarranted or exaggerated, but the fear is impossible to control. Anxiety that gets more intense as a woman gets physically closer to you. Consciously keeping away from women or events where you might see a woman. Or feeling extreme anxiety or fright in situations where you see a woman. In children, gynophobia may appear as tantrums with clenching, crying, or refusal to leave a male parent. Gynophobia is a specific phobia because it involves an extreme and irrational fear of something, in this case, women, who are not dangerous in most cases, but still manage to trigger worry and avoidance behaviors. As with other specific phobias, gynophobia is chronic and can significantly impair your ability to maintain your work, education, everyday activities, and social life. Experts are not sure what causes gynophobia. Some possible causes include previous bad experiences with women, such as mental or physical abuse, neglect, rape, physical assault, or sexual harassment. Your genetics and environment, including behavior learned from your parents or the people around you, changes in the way your brain works. Some people are more prone to gynophobia than others. Those most likely to develop gynophobia include young people, as most phobias, including gynophobia, occur in early childhood, often by 10 years of age. Family members with phobias or anxiety disorders, which you may have learned or inherited. A personality or temperament that is more sensitive, inhibited, or negative than other people. A previous negative experience with women. Being told or reading about a negative experience with women from a friend, family member, or even a stranger. Gynophobia might at first seem like nothing more than an odd personality. However, a phobia of women has the potential to grow into a major obstacle in your life. You should see your doctor if your gynophobia is causing you anxiety that negatively affects your work or school performance, interferes with your social relationships or ability to be social, impairs your ability to perform other everyday activities. Your doctor may refer you to a mental health care provider for specialized treatment. Suspected cases of gynophobia should be addressed, especially promptly in children. Sometimes children outgrow their fears, but because gynophobia can significantly impair a child's ability to function in society when they age, their fears should be addressed with professional medical help as soon as possible. You can ask your doctor to screen you for gynophobia. They will talk with you about your symptoms and ask you to recall your medical, psychiatric, and social histories. Your doctor will also examine you to rule out any physical problems that might be triggering your anxiety. If they think you have a gynophobia or other anxiety disorders, your doctor will refer you to a mental health provider for specific treatment. The majority of people with gynophobia receive their treatment in form of therapy sessions. Gynophobia is treated primarily with psychotherapy, which is also called talk therapy. Exposure therapy and behavioral therapy are the two most common forms of psychotherapy. used to treat gynophobia. Medication may also be used as part of the treatment plan for gynophobia. Usually, psychotherapy alone is very good at treating gynophobia. However, it can sometimes be helpful to use medications designed to decrease your feelings of anxiety or panic attacks associated with gynophobia. Such medications should only be used at the start of treatment to help speed up your recovery. You can also use these medications on an infrequent, short-term basis. For example, in situations where your fear of women prevents you from doing something important, such as getting medical treatment from a woman or visiting the emergency room. Medications used to treat gynophobia include beta blockers, sedatives. Beta blockers control the effects of adrenaline on the body. Adrenaline normally surges when the body experiences anxiety, and this can result in uncomfortable and sometimes harmful physical problems, including a boost in heart rate and blood pressure, heart palpitations, and a shaky voice and limbs. Sedatives such as benzodiazepines can help calm your body by diminishing your anxiety. These medications are highly addictive and should be used with caution. Benzodiazepines may not be right for you if you have a history of alcohol or drug use. Gynophobia can have a huge negative effect on your quality of life. Possible complications of gynophobia include social isolation, mood disorders, substance abuse, and suicidal thoughts or attempts. It's critical for you to ask for help if you need it. It's even more important if you have children who are or could be affected by your phobia. The key to recovery success is continuing your treatment plan to keep your gynophobia symptoms at bay. If you enjoyed this video, subscribe, like, share, and comment.